Thank you so much. While my slides are uploaded, I would like to say a few words. It's a great honor to be here. I would like to thank TASSA and the organizers to give me this opportunity, especially Gökhan and Burhan. I don't think I saw Burhan in person yet. And again, I'm by training, I'm a gynecologist and a molecular biologist. And ordinarily, I give talks to reproductive scientists or the obstetrician and gynecologist community. So it's very different that, thank you. I have this opportunity to speak with a diverse audience like yourself. So I decided to change my usual talks a little bit. Instead of like talking about the mechanism of disease, I want to talk about the epidemiology of common gynecologic problems. And so I would like to start out with pointing out that these are the diseases that I worked throughout my academic life during the past 25 years, but 1 out of every 8 women will develop breast cancer during her lifetime. Again, 1 out of every 75 women will develop ovarian cancer. 1 out of every 10 women will suffer from endometriosis-related pelvic pain or infertility. 1 out of every 5 women will suffer from excessive uterine bleeding, miscarriage, or anemia because of uterine fibroids. And also worldwide, when you look at this globally, a total of some 500 million women suffer from one of these awful reproductive diseases. And so I would like to spend a little bit of time on this slide. I mean, this is like a basic physiology slide. But believe it or not, the brain controls reproduction. Basically, it's a circadian system, and every 28 days, the brain sends these hormones called GnRH and FSH and LH to the ovary. And the ovary sort of like, again, automatically develops an egg and also like secretes these hormones called estrogen and progesterone simultaneously so that it would prepare the uterus or endometrium so that it would be ready for implantation. And if pregnancy occurs, then the embryo would stop this process for about a year. And so there wouldn't be any of this like ovulation and estrogen and progesterone production for about a year. And if the woman would be lactated, this would be interrupted by another, I don't know, like 6 months to a year. So, so that's probably how a woman's body has evolved throughout the times. And very interestingly, these two hormones are master regulators of genes, estrogen and progesterone. And we've developed all these systems to explain that they are some of the major causes of endometriosis, fibroids, breast cancer, and ovarian cancer. So I'm going to come back to this slide and try to provide a different perspective. Again, I mean, it's important to point out that this is sort of like an automatic system. Like if you don't stop it somehow, this will like keep going on and on and on during a woman's life for about from the age of 12 until 50 when the eggs are depleted in the ovary. So breast cancer is a nasty disease. This is cancer. It develops in fat. We've done a lot of studies to explain that fat feeds estrogen to cancer and makes it grow. And okay. And when you look at the map and the, sorry, what am I doing? When you look at the map, you're going to notice that breast cancer is extremely prevalent in Western countries, and its incidence is very low in Africa. And again, in China, probably it's low too, but the one-child policy in China was introduced in 1980, so probably we do not see all the effects of it. But I would like to point out the contrast between Africa and developed countries, that an average woman in Africa probably has still goes through 5 to 10 children and lactates most of the time and dies a little bit early. And so this, according to epidemiologists, one of the major factors that accounts for the difference between the prevalence of breast cancer between these two different worlds. Endometriosis is a very nasty disease. It's the most common cause of chronic pelvic pain and infertility. It's inherited, and our laboratory discovered some of the mechanisms for this genetic basis. 5 to 10 million women in the U.S. Suffer from this disease, and it is a nasty disease because it causes like chronic pelvic pain for 30, 40 years during a woman's lifetime. And it's responsible for about 100,000 hysterectomies that we do in the United States every year. That's what it looks like, the uterus and the ovaries. It could be like these small implants in the abdomen, but it could also work in the ovaries and make them like really large. And again, the way it works is every month a menstruation happens if the pregnancy doesn't occur, and these cells go through the uterus and the vagina, which is called menstruation. But some of these cells go back through the tubes into the abdominal cavity, and they can cause these implants that cause inflammation and pain, or they can populate these follicles in the ovary, which eventually leads to these large chocolate-filled cysts or ovarian cancer. Or it could, like, they can accumulate between the vagina and the rectum and cause intense pain, for example, during intercourse. And ovarian cancer and endometriosis, they go hand in hand. And again, when you look at the world map, it's like both diseases are very common in developed countries, but less common in Europe. I mean, in Africa, less developed countries. Finally, I will just briefly touch upon uterine fibroids. And again, these are like single-cell monoclonal tumors that grow in the uterus. They could grow to these nasty sizes. And these are all the fibroids that came from a single uterus, believe it or not. And up to 77% of women will affect from at least one uterus, one fibroid, but some 20 million US women will be symptomatic from a fibroid during her lifetime. These are the major symptoms, and we do about 200,000 hysterectomies every year just because fibroids. So fibroids and endometriosis pretty much make up all the indications for gynecologic surgery. If we look at the historical perspective an average human being, including a woman, the life expectancy was about 30s or 40s until fairly recently, in 1900s. And as you can see, it increased drastically over the past 100 years. This is true for like any region of the world. So if you like really think that a woman goes through menopause, and usually before the age of 55, many women did not even reach the age of menopause. And again, if you look at fertility rates, how many children a woman went through, and this is the United States, an average woman had like 6 children back in 1800s, and now this is down to 1 or 2 today. So again, this sort of like emphasizes how many menstrual cycles a woman goes through throughout her lifetime. And this sort of like brings me back to this slide again. And what I'm trying to say is I spent all my sort of career on trying to find out these mechanisms. So we found, for example, estrogen and progesterone are instrumental in endometriosis, fibroids, breast cancer, and ovarian cancer. And in fact, we developed targeted treatments like aromatase inhibitors and anti-progestins to treat some of these diseases. But I was like thinking a couple of days ago before I prepared this talk, and this is the first time I'm giving such a talk to an audience, I think the real opportunity is still in like understanding the epidemiology and changing the behaviors of people. Like, I see a lot of patients with endometriosis in my office, and the patient's general attitude is, and also the physicians, is that having recurrent periods again and again and again is a natural process. And I'm trying to describe that this is not really the case. This is not natural. Menstruation is an unbelievably inflammatory process. It's not good, and it's like together with ovulation, the sequential production of estradiol and progesterone, it is sort of like the culprit for the increase in all of these reproductive problems. And most of my session is about education, actually, nowadays, and try to convince the patient that if I could like interrupt your periods, probably you're going to be better off, and you have another probably 10 to 20 years before you reach your menopause. And somehow, if we do not stop this process, for example, we are not going to decrease endometriosis. We are not going to decrease the chances of developing ovarian cancer or breast cancer. So, like, these are some of the means that we have: GnRH agonists, oral contraceptives, or birth control pills, or high-dose progestin, and they really have like really bad side effects. The best one is still birth control pills that I propose for my patients that would stop ovulation, that would decrease pain, and that would like sort of like decrease the risk for these diseases. And this is my last slide. And again, I would like to submit to you that evolution of a woman's body, especially lower brain and reproductive tract, did not catch up with her recent lifestyle choices, and probably the evolution of the upper brain and some of the societal changes we went through during the past 100 years. And again, Don't get me wrong, I'm not saying that women should be pregnant and lactating all the time. That's not my message at all. What my message is, we should really understand that repeated menstruation and ovulation is not a normal state. So I would encourage broader use of birth control pills to suppress ovulation, especially in certain populations with family history, for the purpose of preventing endometriosis and ovarian cancer, especially in susceptible groups. And for example, the best tool that we have for this is birth control pills, but they still have significant side effects. And I would encourage both the pharmaceutical industry and academia to develop new technologies to suppress repeated ovulation. Thanks so much for your attention.